friend joining us today, Dr. Viraj, on this health talk. This is an initiative by Shrenik sir. He's here. And Dr. Viraj is joining us from HCG Cancer Center. He's an oncologist. And today's topic is about colon cancer. So I would request Shrenik sir to, introduce Dr. Viraj because he knows him well. So over to you, Shrenik sir.
Good evening, friends. It's really a pleasure, and I'm quite fascinated welcoming dear friend Dr. Viraj sir. We have been knowing each other for a long time, and I would say he's one of the best medical oncologists, especially for GI cancer treatment. Before I talk a bit more about Viraj sir, we have made a new beginning in the last week of October, and till now we did 11 episodes. I've been grateful along with the team of WurkTV to have various super specialists, and they did incredible job, and they have fueled our health series platform like anything, and till date we have received more than 90,000 views. So today we have come up with altogether a new topic, which is about colon cancer or GI. I mean, too many people are suffering with this disease, and I must say one thing. At times, the people are feeling that this kind of health series is a kind of a time pass. But let me tell you very honestly, I find myself being a survivor in 24th year. Those who have suffered the problem only know the problem, pain, difficulties, social, financial, and psychological trouble. So therefore, we are here again to bridge the gap between patients and super specialists, so that you can have a very wonderful interactive session sitting at your home with Dr. Viraj Lavingia. So, Dr. Viraj, sir, welcome once again, and Ravi, you kindly take it over.
Thank you, sir. Sir, Dr. Viraj, first question, for a simple man to understand, what is colorectal, cancer? Because इसके बहुत सारे नाम हैं, so for a layman to understand what is it?
Yeah, thank you so much, Shrenik bhai and Ravi bhai, to have me here. So to start with your question, what is colorectal cancer? In our medical lingo, it's a very fairly common name, but for laymen, it is cancer occurring from any part of large intestine. You see, we have intestine, long, small intestine of 7 to 8 feet, and then we have few feet of large intestine. So cancer occurring in the large intestine is what we call colon cancer. And everybody poops, right? So the last part of the intestine where the poop is stored, that is called rectum. And if the cancer occurs there, which occurs quite few in our country, then it's called rectal cancer. Colorectal cancer is a major problem of Western countries. So if you see in West, it's about second or third number of cause, while in India, it's still at fourth or fifth number of cancer in our country. So to put in numbers, we have about every year 50 to 60,000 new cases which happen in our country. And if you compare it to West, it's about 1.5 lakhs. So that's just 3 times more. And considering they have 3 to 4 times less population than us, it is far more a problem of the West rather than our country. Nevertheless, we are having more and more globalization, more and more urbanization, and we are seeing more of colorectal cancers in our practice as well.
Okay. So what are the general awareness points, if you could highlight for our audience related to this?
So what I find the
Okay.
yes,
Sorry, sir. Shrenik, sir, we got your audio for a while. So, yeah.
right.
Yeah.
So
Thanks.
no, the first question that I had when I see a patient is, sir, ये मेरे को क्यों हुआ? Why this happened to me? And that's always the first question. Maybe any cancer, the first question they ask the doctor is, why this happened to me?
Why me?
Why me? Unfortunately, if I were to just answer that, but at least in colorectal cancer, we know 4 out of 1, so that's 1/4 of patients, happens in family. So it's a genetic disease, which not many people are aware. Like in just my small experience, we have 5 families diagnosed where father gives it to the son gives it to his son, and the daughters, and then it keeps on going and going and going, and nobody bothers to check. So the good news is we have a simple blood test where one could just test him or herself if patient has history of colon cancer, and we could prevent it nowadays. So, classically correlated with breast cancer, I'm sure everybody's aware of Angelina Jolie in 2013 when she said, I want to do a genetic test because my mother and my grandmother had a breast cancer. How can I'm sure I'm going to get it. How do I prevent it? So since then, since last 7, 8 years, genetic testing has been a boon, especially in the urban class of population. And some other causes like tobacco, alcohol is not very much related to this cancer. By no way I'm endorsing that. But for colorectal cancer, it's more of smoked meat, which again in India is not very common. But in West, it is because of smoked meat. But majority of cases, as a doctor, I have to say, sorry, I don't know, just bad luck, you got it. I just want to tell everyone that if, like in US, uh, we have a policy that if you are age 50 or more, then you should get a colonoscopy done to make sure that whether you have colon cancer or not. So that's not being picked up in our country fairly because of low numbers. But I hope with this media and more awareness, I should endorse all people who are more than 50 should undergo a screening procedure.
So,
That's
yeah, Dr.
I
Viraj,
say.
how do we detect this at the early stage? What are the symptoms and कैसे पता चलता है?
Right. So typically colorectal cancer, about one half, 50% are diagnosed late. Because if you wait for your symptoms, which are typically, blood in stool, or if you just lose weight, inability to eat, constipation, कभी constipation होता है, कभी diarrhea होता है. In our language, we call it altered bowels. कभी constipation, कभी diarrhea. And this is going on for long months. And imagine if you're having constipation for 2 months, you're not going to see a doctor, right? So this is what happens typically with all patients. And by the time they see a doctor, it's already stage 3 or stage 4 cancer. So the best way to detect early is called screening. Screening means an individual who does not have a cancer and wants to see whether he has it or not. So that's called screening, right? Screening does not apply for patients who have already a cancer. This is for people like you and me. So the general consensus is anyone more than 50, that's point number 1. Point number 2, if you have somebody in your family who has colon cancer or breast cancer or ovarian cancer, then they should see your family doctor and say, hey, can I get a cancer? Is there a test which you can do on me and find that will I get a cancer or not? So that's one thing, awareness we should be passing on. The new thing which I'm more excited about, and so far in India we have not got it, but I am behind to get it, is everyone is aware of pregnancy test, right? It's a small strip where if you put urine, 1 strip means you're not pregnant, 2 strips means you're pregnant. So the same thing applies for a FIT test, F-I-T.
Fit.
FIT test. Now in US and UK, everybody age more than 50 on their birthday gets a kit. So you put your poop on the kit. If it shows 2 lines, you go to your doctor for colonoscopy. If it shows 1 line, you live for 1 more year and get it done again next year. So it's a non-invasive test. Nobody touches you or anything. It's a simple kit. You just put your poop inside and see whether you have 1 line or 2 line. It's already there in US. Unfortunately, in our country, it is almost 6 to 7,000 rupees. So it's not very wise to do that on a mass level. But I'm sure some businessmen will always make it in 100 rupees, like a pregnancy test. And once it is done, it will be a very, very easy procedure for us to screen. And only if you screen, you can diagnose it early. And if you diagnose it early, you can live long. It's a simple principle.
Super. So, audience who are watching this, if you have any questions, feel free to ask while Dr. Viraj is live with us. Yeah, we have a question from Jaimin Sagar. Means how far normal human, how it can be differentiated size wise or any other terms. So
what's the question? I need to
yeah, even so let me try to understand how normal human being, how it can be differentiated size wise or any other terms. So I think the question is more about the determination of the intestine size and all that. How would you detect it? I think you've
don't do that. It's a long 7 to 8 feet of just a bag of worm which is there in the small tummies. You don't need to know the length of it. All you have to do is colonoscopy of the colon. You don't have to see the small intestine, which is long. You cannot see that because we don't have those scopes long enough to see them. We have special techniques like video endoscopy for that. But we are not discussing about them today. It's more of colon cancer and not the small bowel cancer, which is a completely different cancer altogether.
Okay, Jaimim, I hope we've addressed your question, but if you have something which is much more clear, feel.
So that I can understand. My brain is a little small. I need to.
Yeah, आप हिंदी में भी पूछ सकते हैं. I'll try to answer. मेरी हिंदी उतनी अच्छी नहीं है, but I'll try to answer if you're, if that will take care of it. Because nice question. Just that since you're live, you have a question in mind. We want to address that. So feel free to ask that question in Hindi if that is comfortable for you. And Vanjana Ramisetti is saying. Maybe he is asking about how to diagnose. So thanks Vanjana for helping out.
Thank you. So yes, how do we diagnose? Diagnosis means only one thing: biopsy. So we need a proof of biopsy. So whenever you see a tumor in the colon, then you go in and take a needle test. In layman language, it's called needle test. In our language, we call it a biopsy. And it typically takes about 1 or 2 days. And it comes at whether it is cancer or it's not cancer. It's something else or it's a cancer. So that's the step number 1. And then you do staging. Once you diagnose, okay, you have colon cancer, then the next step doctor does on you is to stage that. That's the second question what everybody asks. Sir, kaun se stage mein hai mera cancer? That's the test that we perform. Typically, we do a CT scan of the whole body to see whether that tumor has spread somewhere or not. And then we decide the treatment based on the staging.
Okay. Another question from Ankit Parmar is asking, as genetically, what's the diagnosis ratio? So genetically, कितने percentage लोगों को ये आता है?
For colon cancer, it's very high. It's almost 1 in 4. So that's 20 to 25% of colon cancer are hereditary. Or genetic. So as a rule, every colon cancer patient that walks into my clinic is offered this test. That do you want to do this test for your family or not? Everybody.
Okay.
So, and that's the rule in US as well. That's the guideline as well. That all colon cancer patients should be offered. Whether they want to do it or not, it's a separate issue because there are some technical challenges with it. Let's say I do a test and I get a positive test. Then if I'm an individual who likes to stay in worry that, oh my God, I'm going to get cancer in future, what to do now? So then it's rather not up for you. It's only for proactive people who wants to fight that, okay, doctor, tell me next step. How can I prevent it to happen? Then, so this is a long conversation. I have to spend almost 30 minutes with every patient who shows interest that they want to check whether this is hereditary or not. And it's a separate clinic altogether.
Okay. We have another question from Vanaja. Vanaja herself is a cancer survivor. So, doctor, what are the precautions we need to take to prevent such cancers?
Right. So for colon cancer, the normal shenanigans like live a healthy life, diet, exercise. Very recently, if you want a science behind it, for patients who have colon cancer, coffee drinking, and we were just discussing that coffee drinking of at least 2 to 3 cups significantly reduces the risk of cancer coming back. So this is not for patients who don't have cancer. This is for patients who already got cancer and are so-called cured. I tell all my patients to go and have 2 or 3 cups of coffee if they like it. And there is a good science behind it. The study has finally proven that you could reduce the risk of cancer. Second is a simple tablet called aspirin, which I'm sure in India it's like rampant. Everybody is on aspirin. All our mom dads are on aspirin. It's a simple blood thinner. Aspirin, so all my colon cancer patients are on aspirin because aspirin also has shown to reduce the chance of cancer coming back. So these two are, we have very good science behind it. Rest all is jargon, just live a healthy life, have a good diet, have good exercise. So that's what we can do. Otherwise, if you have somebody in your family who has already fought it, then my sincere recommendation is to undergo genetic testing.
Okay. Doctor, what are the general treatment options available for this particular cancer?
Yeah, so for colon cancer, let's talk a little bit about colon cancer. So all cancers, like any other cancer, we have 4 stages of cancer, right? Simple is stage 1, stage 2, stage 3, stage 4. And this is we diagnose after a proper CT scan. Some people also do PET scan, but for colon cancer, PET scan is not required. A simple CT scan should be good enough. So if you have stage 1, only surgery is good enough. Just get yourself tumor removed from a surgeon. Of course, we have new developments in the surgery. You could do a keyhole surgery, you could do a robotic surgery, or you could do just classical big scar and then remove the tumor. But nowadays we are all doing more of keyholes and or robotic surgery. So if you are stage 1, you just remove the tumor and end of it. That's it. You just keep a follow-up with your doctor for at least 5 years, if not 10 years. For stage 4, it is different. It's called incurable cancer. A majority of them, but few of them can be still cured. And they only rely on chemotherapy. And there is something called as targeted therapy, what is used for colon cancer. And with that, patient can live for a few extra years with a good quality of life. For stage 2 and stage 3, which is the typical 50% of our bulk, like if I see 100 cancers, 50 of them will be either stage 2 or stage 3. This is where you do surgery, and after surgery, you do something called as chemotherapy. Chemotherapy could be pills or could be IV, and it's dependent on which doctor you are seeing. But either one is same. Many patients prefer pills. They want to take it at home. They don't want to come to your office visits. So for stage 2 and stage 3, you get your tumor removed, and after that, for 3 to 6 months, you take chemotherapy. Now, there are some new developments in colorectal cancer, where I'm a medical oncologist, so I specialize in chemotherapy. We have new evidence suggesting that if you take only 3 months of chemotherapy and not do all the 6 months, that is for majority of patients, 99% of patients is more than enough. So that's good news for our patients. Since 2018, so the last 2 years, all of our patients are only on 3 months of chemotherapy after the removal of their tumor and not the 6 months, which is very cumbersome. So that is something a good news. Another good news, what we have is, I've got a couple of things here, if I'm allowed to show. This is called Chemo Port, as I can see. This is called Chemo Port. where everybody is used to getting a puncture in their hands. So this precludes that. You put this on the chest, just one inch, and then chemotherapy is hands-free, like we use hands-free nowadays. So this is hands-free chemotherapy. Your hands are completely free. The chemotherapy is attached here, and people actually go to work. So we call this as ambulatory chemotherapy. Ambulatory chemotherapy is this. It's a pump. As you can see, it's a pump where you fill in the chemo, and that chemo stays in your pocket, and this wire is attached here, and patient is in the office. So patient is working, discussing like us, while chemotherapy is ongoing. So these are the new technologies which have come, which has made patients' lives so much easier, especially for colorectal cancer. There is no hair loss nowadays. We have something called as school caps. So we are developing more and more, and I think so all of our patients are more and more happier that पहले जो कीमो होता था black हो जाते थे and बाल जाते थे मुंह में छाले आते थे, all those things have reduced dramatically with these more new and new technologies. So yeah, I think so technology does help in general, even in healthcare. It's just good news.
Superb. Thanks for bringing those for the show, because yeah, वैसे बताने में just for words versus दिखाने में there's a lot of difference, and I'm surprised by seeing these gadgets which are like so small. I've heard about it, but I thought वो dialysis machine की तरह बहुत भारी होगा, बड़ा होगा. These are cute and simple. Surprising.
These are always there on my table because my job is colon cancer. So daily I speak like this for 10 times in a day. This is good, this is good. So it's come natural now. But yes, this is far, far, far better technology. No puncture in your hands, and patients are generally happy.
Superb. So, Dr. Viraj, we have another question. This is from Priyanka Patel. Hello, sir. My name is Priyanka Patel, Director of Rapture Biotech Ahmedabad, with specialization in molecular diagnostics. I'm interested to know more about the current research and molecular diagnostics about colon cancer, and when do we need medical consultation?
Yeah, so molecular testing, it's a fantastic question. It's a very, very dear subject to me. We use it in two scenarios. One is for what we discussed, that patient does not have a cancer, and patient wants to know whether my mom had it or my dad had it, will I get it or not? So that's a blood test. So that's a genetic molecular testing what we do. It's called germline testing. That typically takes about 1 month for results to come. And if that shows positive or negative, based on that, you take a genetic counseling. Let's see if you're negative, you just relax. If it's positive, then you have a whole gamut of procedure to follow. Then you need to do this, that. Second molecular testing, what is referred to is patients who already had a cancer. So patients who already have a cancer, just like chemotherapy is the old 50-year-old technology, we have new technologies like targeted therapy and immunotherapy. These are the two new therapies which have come with a boom. In fact, if you see US, there are hoardings of it. The televisions are starting to show advertisement of immunotherapy. So what are these? So these are based on certain genetic molecular alterations in the tumor. So if somebody has cancer, we do a testing called NGS, next generation sequencing, which I'm sure she's what is referring to. And that I do it for all my patients who are stage 4 cancer. That's used for stage 4 cancer. And based on that report, we can use these new toys, what I call is targeted therapy or immunotherapy. And the excitement about immunotherapy is, it does not go and kill cancer. It tells your immune system how to kill the cancer. So there is a potential that once you do it in a right patient with the right genetic alteration, patients with stage 4 are cured. There are patients who have lived for more than 5 years, 10 years, even in stage 4 cancer. So that is something, the biggest leap of development that we have seen in colon cancer. And I agree with her that for all my stage 4 patients, genetic testing is mandatory. if they have to see me, they have to get this test done.
Yeah.
Thank
Thank
you
you
for
for thank you for that question, and thank you for answering that, Dr. Viraj. So the next question is from Vidyanka Parmar. Sir, in India, there are many people getting diagnosed with cancer. What are the risk factors?
Yeah, so let's say oral cancer, it's the commonest cancer in our country. It's classically tobacco, smoking, alcohol. These three things, no doctor should be endorsing it, and hence I will not endorse as well. Uh, Other cancers like women cancer, breast cancer, ovarian cancer, that is typically either family related or obesity related. There is a lot of going on with obesity, so that's why exercise comes into picture. That try and stay lean and thin, and you might reduce the risk of women cancer typically. For colorectal cancer, diet is important. I don't think so in our country people are eating more of smoked beef. It's banned in our country, so that has been proven to cause more colon cancer. But in our country, that's not an issue. So apart from that, there is nothing as a normal human being you should be concerned about. Just make sure you live a normal, healthy life. If you want to avoid a heart attack, what would you do? Just do the same thing for avoiding cancer. That's a simple take home message. There is no extra thing that you could do. If you want to prevent a heart attack, what would one do? That's the same thing you would do for preventing cancer. Rest is all on luck.
Thank you. Nice question, Vidyanka. So, this question is from Vanaja. I saw people shying away talking about colon cancer. You know, मुश्किल होती है उनको बताना कि कहाँ cancer आया है. They hide it till the last stages. How do we spread awareness on this?
Excellent question. Just talking like this, we should be doing more and more sessions like this. Patients think having cancer is a taboo. That, oh my God, I've got cancer. I must have done something wrong in my life. And this typically happens in breast cancer with rural women. You know, I was shocked when I was doing residency to see this big football-like masses in their breast, and they would have not even told their husbands or any family members. And when they come, it's a huge tumor. It just boggles me that how someone can, move around with such big lumps in their body, and just because. So partly our society is also at fault. Oh बाप रे तने क्या आपको कैंसर हो गया? Oh बाप रे आपको कैंसर हो गया? And such things, create more taboo. So the only way is to do meetings like this. That's nothing to worry about. If you come early, we can cure you. Completely, we can cure you. So I hope if Ms. Vanaja helps us in spreading this awareness more. Uh, we lack support groups in our country. Well, in US, you have a lot of support groups that they spread this awareness that if you have cancer, don't worry, you'll get cured. Please see your doctor. Simple. Just don't move around with these big problems for months and months together.
Yeah,
So
Vanaja is part of one of the support groups in
great.
Hyderabad because she is a survivor herself, and a lot of stunts she does. She is a good example for doing it. Shrenik sir, you.
I want your contact details, and we can together do something more for colon cancer. I would be more than happy to be part of the project that you are doing. Definitely, I'm honored.
Thank you, sir. So, Shrenik sir, over to you. I mean, the greatest support system who's been doing this for a long time. Sir, any questions from you or anything you want to add here?
Yes. I will be asking questions on them a bit later.
Okay.
But few things I would like to emphasize very precisely. One good thing what Dr. Viraj said. Usually when we are talking about cancer, usually there are no good news is or good news at all. But today Dr. Viraj very well exampled the good news, and in fact I would say he has stolen. I'm repeating a word or a sentence. He has stolen my word, saying is believe it. I mean, by by showing those stuff to the people, to the community, people can start believing now that yes, chemotherapy can be like a hands free, and I believe that that is a biggest and fantastic news ever. That is one point. Secondly, about this ad series through WurkTV platform myself, and by inviting this or this super specialist, I would love to convey the message by myself being a survivor in 24th year. I would like to convey the message that yes, there is a life even after cancer. You need to fight it out. You are not supposed to quit, and you need to have a will to get back to the normal, and don't expect ever any kind of sympathy. Follow your doctors. And lastly, as always, I am saying in all sessions that Indian oncologists, they are at their best, be it in terms of experience, be it in terms of knowledge, technology, and yes, on top of that, they are really being human. So if you don't have a fancy for going abroad for the treatment, and telling people that I got my treatment in New York or London, there is really no need for going abroad for the treatment. I mean, let us be Indian and remain Indian and rely on our Indian oncologists. Absolutely. And so last question. I mean, usually when oncologists, surgical or medical oncologists, when they are saying that you need to opt for the immunotherapy, usually the patients and caregivers, they are feeling that it's like a kind of end of the life. So I would like you to focus on the specific sentence, like is it really end of the life? Because too many people are asking such question that I have been advising immunotherapy, and how much time I am left with. Kindly address this.
Thank you so much. I wanted to discuss this. So I'm a little bit of a more of philosophical person also. So when somebody asks me what is the benefit, then I always try to balance with the risk, right? So there is no doubt that immunotherapy is beneficial. In fact, it has got Nobel Prize. In cancer in last 40 years, there is no treatment which has got Nobel Prize. So this is the treatment which has got a Nobel Prize. That means it is beneficial. The problem with immunotherapy and the concerns what people have is it's expensive right now because it is coming from the West. We have to import it. These companies are selling it at a premium. And that is where the whole balance of benefit versus risk comes. So we are the one centers at HCG, one of the largest experience with immunotherapy in this state, at least in the Western India. And there are patients whom were told by doctors, other doctors, that it's done, seva karo, khatam, it's no more, it's useless to spend even a single rupee. And they are still with us, just like you, 4 years, 5 years out on immunotherapy. No cancer at present, despite being stage 4. Now, the problem is this happens at currently at 1 in 5 rates. So about 20% will get this benefit. So if I were to tell you that this immunotherapy, which I know pharmaceutical companies in India are developing their own, within a year or two, we would get it in market. So then it's a moot question whether somebody should do immunotherapy or not, because it will be very cheap, just like chemotherapy, and everybody will be get. So if we were to do this meeting 5 years from now, you will not hear a word chemo from my mouth. It will be only immunotherapy, because by that time we will have more affordable immunotherapy. Right now, it is quite expensive, in the tune of 1 to 2 lakhs every month, which I agree in our country is a big problem. But for affluent class, I always say, if you can afford it, please go for it. The science is there. Let's try your luck. If you are in 1 in 5, you shall live for a decade, but hopefully. So there is no problem. And another good thing about immunotherapy is there are not much side effects like chemotherapy, hair loss, mouth ulcers. It's nothing like that because it tweaks your immune system. The only problem is cost. And I urge my Indian pharmaceuticals to please make it fast. At least I know 2 companies who are already under development, and hopefully by 2023 we should get our Indian immunotherapy, and I'll be very excited.
Super. Yeah, that calls for a clap. Dr. Viraj, we have another question. Akshita Patel, she stole my question. So, any suggestions about diet for parents? So, generally parents ask this question for kids, but she's asking diet for parents. So
typically for GI cancers, there's a general term that I use. We should try and avoid maida, the breads. We should resort to more of wheat-based bread if you want. I try to say less of refined sugar, although I should be cautious that the science is not very strong, but there is some science behind it that pure refined sugar may be a little bit harmful. And if you are a sweet-tongued person, you could do more of good, what we call, or honey-based sweetness. That's typically what I say to my patients, and more of protein diet, less carb. So again, let's go back to the heart condition. If someone were to have a heart problem, what diet would you suggest? That's the same diet you would suggest to any normal individual who thinks that they will be protected from cancer by having a good diet. But well, that's a myth actually. If you're going to have it, you're going to have it. Diet is not going to prevent it. Unless you are venturing into very poor diet of smoking, alcohol, smoked meats, and a huge non-vegetarian diet. If you are avoiding this, then you should be fine.
Okay. Adding to this particular question related to diet, good diet is fine, but will very good diet, like बहुत लोग आजकल diet के पीछे पड़े हुए हैं. There is keto, there is different types of high protein diets available. Will this have any effect? Because I personally believe the gut health is like very important for immunity. So will this have any impact on getting colon cancer in future, because they're drastically reducing what's generally naturally eaten?
So yeah, we have a science, and as we were discussing, little bit going off the track, we have something called as poop capsules. Means these are the capsules made of somebody else's poop. And why do we use that? Because that poop consists of some bacteria. So everybody in our intestine, we have bacteria. Some people have good bacteria, some people have bad bacteria. If you have good bacteria and give it to somebody who has bad bacteria, there is a science which says it reduces colon cancer risk, right? It's already done. It's already proven. You don't have to prove it. And hence, I think diet will have a role in preventing it. It's just that we don't have a proper study saying that if you eat X, Y, Z, you won't have it. If you eat A, B, C, you will have it. So currently endorsing a particular diet, keto diet, I know people want to reduce weight, want to do intermittent fasting. People do lots of many things. There is no direct correlation that it reduces the risk of colon cancer, but a general concept should tell that if you try to remain fit on bowels, it should help. Many people also try to do colon wash. I know there are certain centers who offer, sir, आपका intestine साफ कर देते हैं, and that should make you more healthy. Well, there is science behind it, but it comes with their own problem. If you do a lot and cause a lot of diarrhea, you could land up in other issues. So I would try to stay away from all these things and just, I again repeat myself, stick to good diet. So far, the science only says good diet. Anything new is just suit yourself.
Okay. So Indians are so used to spicy food. So, first thing we imagine, आज spicy food खाएंगे तो कल के सुबह क्या
So
होगा? So, does this have any impact on it, or
there
is
is a
it helping?
study from, I think, some Hyderabad or Chennai, I don't remember off the head, that sambar protects you from colon cancer.
Oh my God.
Oh yeah, it's published in one of the reputed journals. But again, so we know turmeric is very protective for general cancer, and Indians use a lot of turmeric in our day to day. But again, pinpointing on what ingredient is actually protecting us, it's very difficult, and you need a large study to prove that. But just a fun fact, when I read this study, I said, "Oh my God, kal se dal ki jagah sambar khana hai." And as a Jew, it's difficult to do that. But yeah, so it's not much science. Spicy food, uh, especially if you see Kashmir, let's say North India. Again, we have a study from there that if you eat a lot of spicy food, you get a food pipe cancer or a stomach cancer, not colon cancer. And they proved it in the Kashmir University. So, and they use a lot of that hot tea drink called the kava, and that also burns your food pipe. Even that they proved it that increases the risk of food pipe or stomach cancer. But in this part of our country, it's not very well consumed modality.
Okay. So we'll go through the questions quickly. So Suhana Sheikh, she's asking, with colon cancer, can a patient be stable?
Yeah.
आने के बाद, will the person be stable?
So if colon cancer is detected early, within few months, patients will be cured. So not only stable, patient would get the life what God has intended for that patient, the full life. Like Shrenik Bhai is there with us, 25 years survivor. For stage 4 cancer, if you're asking, generally patients in our affluent class, if they are able to take all treatments, on an average, they do survive about 3 to 4 years with good quality of life, despite being in stage 4. People always come and ask me, sir, these celebrities, Kobe stage 4 tha, and they are still surviving. The cricketer was in stage 4 and he's still hitting sixes all the way around. Well, you have to understand these were different cancers, and we are not necessarily talking about one cancer. So yeah, very much colon cancer can remain stable for long time. In fact, I have patients, and I'm sure somebody are there with us right now. They are for 2 years taking treatment at home. They only see me once every 3 months. They are advanced stage, means they are never going to get cured, but they are living normal lives. They are going to offices. They are just taking treatment at home. Once every 3 months, they come into office visit. So absolutely, colon cancer can live a normal, stable life.
Okay, sir. So the next question is from MT Boyaz Betty. What are the initial symptoms of colon cancer, which we have discussed, and what is prognosis?
So prognosis is highly dependent on stage. Stage 1, excellent, 90-95%, you will be living for decades and decades. For stage 2 and 3, again, 70-80% of patients will be living a normal life. It's where the stage 4 you want to ask prognosis. And as we discussed, that typically in my center, patients do go for third or fourth year on an average, despite being stage 4 colon cancer.
Okay.
So I would say it's a good prognosis.
Okay. So the next question, sir, this is from Purnima Gupta. You said immunotherapy is giving awesome results, and we know that there is less awareness about it in the people. How can we create awareness to more and more people that we save human lives?
So, I was going through this Google a few months ago, and I saw an image. This image was on the hoarding of New York Times Square, and it said the best weapon to fight cancer is, and that was YOU. And what does that mean is immunotherapy means your own immune system is capable to kill cancer. It's just that you have to tweak it. So these awareness are rampant in Western countries. There are television ads, there are hoardings. The thing is they can do it because their government is paying for that. Here, if we do it, we will be sounded as people who want to mint money, which is not the case. because it's genuinely useful. The problem comes, it's because it's costly. And whenever the cost is involved, the mentality of patients can be skewed, that I got 10 lakh treatment and I still didn't make it. So same thing happened with COVID, right? People said we spent 10 lakhs in ICU, still our patient didn't survive. So it's the same thing. So endorsing something where you have to have out-of-pocket economy is difficult challenge. But if you have support groups, I would be more than happy to be associated with those groups, spreading small awareness. We cannot broadcast this, absolutely not. But doing small meetings like this, we can help and we can bring change. That's my suggestion.
Yeah, that's a lot of awareness. I mean, a lot of learnings for me also personally, from this particular session, Dr. Viraj. So, as a conclusion, what are the suggestions you have for people out there, people who have colon cancer, people who do not have colon cancer, and people like us who can create awareness or spread hope that cancer is curable provided you take tests. So, what is the message you have for everybody?
So first of all, thank you. It was a fantastic thing. It was a nice experience for me. I'll be honest, this was my first experience like this on live. I've done many medical lectures, but for this one, I was having butterfly because I've never did a live session before. But great, I was very comfortable. You were a fantastic host. I must appreciate.
Thank you, sir.
So let's talk about people who don't have cancer. My mantra is get screened. Please ask your doctor that if I want to have screening procedure, please guide me. So my suggestion is, if you are more than 50, so like my mom, dad, whenever they were 50, I said, get your colonoscopy done. And it's only once every 10 years. So it's not a big deal. So for colorectal cancer, this single-handedly, hands down, can save lives. It's a simple step. Age more than 50, your parents, rather than focusing on the diet, the person who asked us this question, please get them screened. That's point number one. Point number two, for patients who have already cancer, make sure you are seeing a proper oncologist and a surgeon, a well-reputed surgeon. The new techniques like robotics and keyhole surgeries are better. So if your finances can help you, make sure you go ahead with that. There is no point in getting afraid of chemotherapy. I hope I have made that very clear. There's no hair loss. It's hands-free. It's take-at-home treatment. Even you can take it to your office. So there's nothing to worry about that. In fact, we have a young lady coming to me tomorrow. She's a computer analyst, and she said, I want to work. I said, please go and work. Just make sure you put a chemo and then go work. So it's very easy in that way. And that's about it. Even in stage 4, we have new treatments like immunotherapy and targeted therapy. Make sure you ask your doctor accordingly that will that benefit you or not. So I think so that should be a good take-home message. If my audience are happy, if they want more, then I'm more than happy to give them.
Yeah, thanks a lot, sir. Shrenik, sir, over to you.
Yeah. Dr. Viraj, with your permission, I would like to answer the question of Purnima Gupta. In fact, just in order to spread awareness, we are conducting or featuring this live shows by inviting specialists like you. So, I would recommend, or rather, I would suggest that, you spread word to attend our such sessions from time to time, and you will be getting absolutely free of cost advice, and that too sitting at your home. And these are most reliable information insights you are going, and these informations are real time details, and at least you need not have to Google to find it out, or you need not have to use any kind of other browser and relying upon this. These are based on the real experience from the super specialists we are bringing on this platform. And last but not never the least, uh, as a matter of fact, this TED series is the world first TED series being conducted, initiated by a cancer survivor, and that's I'm having a privilege
Yeah.
of meeting too many people. And again, I would like to say we are trying to bridge the gap between cancer patients and super specialists. So this is all I have to say. And Dr. Viraj sir, thank you so very much for stealing out your valuable time. And we would like to have you on our platform once again. Thank you so very much.
Thank you, sir. Thanks a lot for taking time out. And thank you, audience, for watching this and those awesome questions. Please spread awareness. Please spread this particular video if you have any issues, because screening is very important. And Dr. Viraj, you can also consult Dr. Viraj. You can connect with him in his social handles. I think 20% of the cancer is gone, just after seeing him, the way he talks and the way he creates hope and liveliness, while giving these suggestions. So thanks a lot. Thanks for giving your valuable time on this particular show.
Thank you so much.
Thank you. Thank you, audience. Have a great day.